Welcome to Let's Talk Mental Health, where we bring awareness to the causes and solutions of mental health conditions. I'm your host, Nathan Nedley, and this is the first part in a 5-part series we're doing on the 10 hit depression categories. This deals with causes of depression. I've got Dr. Neil Nedley with me. Thank you for joining me, and let's get started. What are the first ones we're going to be looking at today?
We're starting with genetic and medical categories of causes of depression.
What exactly is a genetic cause?
Well, these are mutated genes that actually have consequences in regards to brain chemistry. And so there are several common genetic causes of depression. And when I say causes, once again, it's a contributing cause, but never a sole cause.
Okay.
Because genetics loads the gun and lifestyle pulls the trigger. So there are other factors that are going to activate these genes. But when the gene is active, we'll actually be able to measure the activity of that gene. And that's part of the blood work we do when people come to the residential depression and anxiety recovery program, because we want to understand the genes that are active to know how to deactivate them. So one of the common genetic causes is called undermethylation. This is a condition where serotonin activity is down and dopamine activity is down, and sometimes, depending upon the other genetics, norepinephrine activity is down. These are 3 neurotransmitters that are being affected a lot by medications. Most of the medications are going to affect one or more of those neurotransmitters. But it turns out most of the time these medicines would be unnecessary if we understood the defect and actually solved that defect through nutrition and lifestyle measures.
You're talking about undermethylation. Is there an opposite to the under? Is there an overmethylation?
There is an overmethylation as well, yeah. And most people, fortunately, are normal methylators. Less people are overmethylators. But there's difference in personalities that we will see between the undermethylators and the overmethylators. The undermethylators tend to be overachievers. They tend to be have a greater tendency for obsessive compulsive disorder. So they want to do well in whatever they are in. If they're in school, they want to get an A. If they're in sports, they want to win. And they will kind of do what it takes to become an overachiever. Socially, they're fine among their peer groups, but they're not people that are very socially appropriate. Not that they're inappropriate.
Maybe outgoing.
But yeah, they're just not as outgoing outside of their peer group as well. And so they kind of stick to themselves. They don't even mind being oppositional in regards to social things at times because of where their priorities are at. They tend to have a very calm exterior but a tense interior. And it turns out overmethylators, they tend to be your more social people. You know, if you live next door to them, they're going to be very kind and nice and empathetic to you, even though they didn't know you before. They're more naturally empathetic people. They're more naturally extroverted as well. And they are also people that tend to be more creative. These are the people that are going to be more artistic. The artistry needs to be taught to the undermethylators, but the overmethylators just seem to have it naturally. And music can come more naturally to an overmethylator. So we also look for personality traits sometimes to determine where they're at, but of course the blood work will give us the final analysis.
Now, we probably have some people that are watching who would say, maybe I would want to be an undermethylator and overmethylator if they're saying wanting to be good at art or music or wanting to get into medical school and need good grades or things like that. If someone is, say, an undermethylator or an overmethylator, and you fix the imbalances that are happening, is that going to decrease their ability to, you know, or their motivation to get good grades, or say their artistic abilities or things like that?
That's a great question, and a lot of my patients wonder that as well, because they're here because of their depression and anxiety, and they want that fixed, but they don't want their competitive edge fixed or their creativity fixed. And fortunately, because of the genes that they have, they'll be able to stick with the positive parts of that, but we'll actually be able to deactivate the negative parts of it. So we're selective in what we're actually helping them out with. So we won't change their personality or change their talents or change their motivations, but we will help their mood and their ability to manage their emotions far better.
Let's get into the second one, which is medical condition. What are symptoms of that or causes relating?
Well, premenstrual dysphoric disorder, for instance, is a medical condition. This is where women tend to become a lot more sensitive and emotional on the second half of their period or right as their period is starting. And it turns out there's a crossover between that and the genetic, because the genetic trait that tends to be associated with that is a metal metabolism disorder. And this is where they don't have the ability to handle copper as well. And too much free copper will cause them to have postpartum depression, premenstrual dysphoria. Any hormonal depression event tends to be associated with that. And we'll pick that up in the genes. And we'll be able to fix that actually with certain supplementation like zinc, for instance, which can get rid of copper. But we have to do it in the right amounts, because if we overshoot, we're going to bring the copper level down too low. And they'll have more anxiety. And so we have to gradually build up until we reach that particular level. Thyroid conditions, that can be another medical cause of depression, and this is why we measure the thyroid in 5 different ways in people that come through the program. Inflammatory disorders, autoimmune disease can be another medical condition that we'll pick up in the lab work and be able to do some things to correct that, often nutritionally, using long-chain omega-3s and getting rid of arachidonic acid. And that medical condition can be taken care of through nutrition and lifestyle measures. And so there could be a whole host of things that we pick up. Head trauma, that's another one. Post-concussion syndrome, post-traumatic brain injury, that causes inflammation in the brain, and that's actually a medical condition that was induced from trauma, actual physical trauma. And so we look for a host of medical causes as well as a host of genetic causes, and this is one of the key factors that they learn about themselves in our program that they can actually reverse so that we can completely eliminate those 2 hits, and what a difference that's going to make in their future.
Wow. I guess starting this topic of both genetic and the medical condition, they sound like they're very difficult to change, and I'm sure they are, but it seems like from what you're talking about that through in-depth study with lab works and things like that, you're able to make small minor adjustments in areas that can provide significant results.
Oh yeah, sometimes it's not all that complex on what we have to do. On an undermethylator, it might just be one supplement they need to do, or it might be some other lifestyle measure and we'll be able to have normal methylation. Another genetic condition, a pyrrole disorder. With that, they're going to be an opposite of an undermethylator. They're going to have more of a learning disability. They won't be able to read and focus and concentrate very well. And we'll pick that up, and within 4 weeks, with just some simple supplementation, their focus improves, their memory improves, their ability to achieve in school goes up, and their stress control is way better managed. Just as a result of getting rid of the pyrrole disorder, another common, about 15% of people that come to our program have that disorder.
Wow. Well, thanks for going over those first 2 hits, Dr. Nedley. Join us next time as we go over lifestyle and circadian rhythm hits. This is Let's Talk Mental Health. I'm your host, Nathan Nedley, and as always, stay healthy, live happy.